ulcer disease, stomach ulcers, duodenal ulcers, all these problems are less common nowadays because of availability of very good medications, that is proton pump inhibitors. Most common ones like omeprazole, pantoprazole, lansoprazole, etc., esomeprazole. All these medicines are very effective. They make the acid secretion to zero. Other than that, we have H. pylori eradication treatment. So H. pylori, Helicobacter pylori is a bacteria which will increase the acidity, and also it can cause stomach cancer also. Helicobacter pylori is a bacteria which thrives in the stomach and increases the risk of gastritis and acute ulcers, chronic ulcers, etc. With the availability of these excellent anti-ulcer medications, H. pylori treatment, the incidence of ulcer disease has dropped significantly. But still we get to see some complications of chronic duodenal ulcers, especially bleeding, perforations and outlet obstructions. So what happens is, many patients, when they neglect the symptoms and they go undiagnosed, they develop certain complications of the ulcers. So many patients, they may not take treatment, appropriate treatment, they don't get evaluated, they don't take the prescribed treatment for the stipulated time, for the prescribed duration. This is the reason they may develop complications. So what we see in practice is perforation. Ulcer, when it becomes deep, what will happen is it breaks open. It's called as perforation, and the patient will get severe abdominal pain, and that requires an emergency surgery. This is one of the common complication of ulcer. The second thing what we see is bleeding, especially the ulcers which are in the back of the duodenum. They erode into a vessel. So there is a blood vessel behind the duodenum. The ulcer will penetrate deep into the blood vessel and they start vomiting blood. This is a very fatal complication. The patient needs to rush to the hospital to do either endoscopic therapy or interventional radiological procedure to embolize and block the artery. Sometimes the patient may need surgery also to stop the bleeding. So yet another common complication of ulcer disease is gastric outlet obstruction. So the ulcer itself will induce scarring around the duodenum or the stomach, and it will narrow the lumen. The passage gets blocked, so they will not be able to eat food. Initially, taking solids can become very difficult. They'll be taking only liquids because they can't eat solids. If they eat solids, they will start vomiting. Eventually, the passage gets blocked completely and they are not able to even drink water or swallow the saliva also. This is called as gastric outlet obstruction. This is one of the complications of a untreated, long-standing chronic duodenal ulcer, and these patients need either endoscopic therapy or a surgical treatment. Endoscopic treatment for selected cases